Awesome. Hi, welcome to the live stream. I'm Mikki with Maine Access Points, and joining me I have Aspen from Mabel Wadsworth Center. Um, so tonight we're just talking a little bit about STIs, sexual health, um, a wide array of things in there. Um, talking about sexually transmitted infections, anything sexually health related can be kind of difficult with stigma and shame that people face over them. So we just really wanted to create an open space for anybody that tunes into the live stream to be able to ask questions and kind of answer any common questions that may arise. So, and we do have you do have access to the chat. So if anybody has any questions, feel free to put it in the chat and we can answer them right as we go along. We want to make this as conversational and as informative as possible and tailored to your needs. So I'll let Aspen introduce themselves and then we can get into it.
Yeah, I'm Aspen. I use they, them pronouns. I work with Mabel Wadsworth Center. My fancy title there is I'm the community engagement coordinator, which mostly means that I just do stuff with community engagement. So things like this. I was at the State House today, which I was complaining about to Mikki before we started. I host our podcast that we have for the center. But really my favorite thing, with events like this is doing education stuff. I really like talking about sexual health, but like you said, that stigma, that taboo, that shame really keeps people from talking about it. And I think also because there's the regular just kind of like stigma and shame that we have around anything to do with sexual health anyways. But then when you have someone who's like, well, I know I shouldn't be ashamed of this, then they kind of have another level of where they feel ashamed because they have shame. And so like it's an unfortunate like shame sandwich that traps them a little bit. So I say all that to say that like, even if you are someone who is actively trying to not have shame around these topics, it's okay to feel that. Like you are not doing something wrong because you're having a normal response to how we've all been taught to view these topics. Like you are not, I don't know, bad at advocating for yourself because you're having a normal emotional response. That's something that's come up a lot, both just in my education work and I used to do rapid HIV and Hep C testing for folks. And that was something that would come up in those spaces a lot too, where people were just feeling like really bad because they had shame and they were like, I know I shouldn't be ashamed. But yeah, don't beat yourself up for, having a normal response. So obviously, talking about STIs, there are a lot, there's a lot of directions to go with it. One thing that I will kind of cover at the top, because this is something where I have found people often like get kind of confused because they'll be like, don't you mean STDs? Why are you calling it STIs? I don't know how many years ago, some years ago at some point, it was kind of decided as far as correct language, STI, which stands for sexually transmitted infection, is more accurate because STD, which is sexually transmitted disease, isn't always accurate because something can be an infection without being a disease. That's like, getting in the weeds of stuff. So like if you say STDs, like talking to your healthcare provider, they're going to know what you're talking about. And in fact, there's a good chance that your healthcare provider might be using the language of calling them STDs because it's what people tend to be more familiar with. So if you were like, Aspen, what the hell's an STI? Why isn't it an STD? That's that. I also want to say I will talk a little bit about some of the specifics with STIs, but the most important thing to know is that if anything ever feels off, or even if it doesn't, but you've just been sexually active, even using protection, you want to get tested. More than half of all people who contract an STI don't have symptoms. They are asymptomatic is the technical term for that. And if you don't have symptoms, then, a lot of people, if getting tested isn't just part of your regular practice, then, you won't know that you have it. And even if you have an STI and are asymptomatic, it can still cause long-term health problems. So that's, brings us to another point, like what is the danger and what is the risk when it comes to STIs? Honestly, the biggest risk, the biggest danger factor of STIs is stigma. Because stigma and shame stop people from accessing testing and from accessing treatment. And when people are not getting testing and treatment, then they, are not taking care of their health. The majority of sexually transmitted infections that exist out there are completely curable with usually antibiotics. I'm thinking like chlamydia and gonorrhea, some of our most common STIs out there. Even the STIs that aren't curable, that are kind of like, maybe it's a virus, so you got it the rest of your life, they are totally manageable with medications. We'll talk more specifics about that, but so I'm thinking like herpes, I'm thinking like HIV, even things that are presented as being a like quote unquote life sentence, are things that people can live happy, healthy lives with. But going back to things like, well, really all STIs, but particularly those that are curable, knocked out with a round of antibiotics. But if someone has that, if someone has, say, gonorrhea, and it goes untreated for a really long time, it can cause other health problems. In the case of things like chlamydia and gonorrhea, that might look like pelvic inflammatory disease, which just means like chronic long-term pelvic pain, rather, not plain, and it can also cause some issues with like fertility. Now, if someone, gets chlamydia, gets gonorrhea, and gets it treated, they're fine. It's not going to be an issue for long term. And that's, again, that point of like how stigma and shame hurt people. When people feel too much stigma or shame or just don't know what they should be doing to take care of their health, then it can cause long-term health issues for something that really is otherwise kind of like a cold, insofar as that, like, yeah, people get sick. That's not an abnormal thing for people to do, is to get sick. One STI that is like totally curable with antibiotics, but that can have some other kind of like, long-term, like more serious health impacts if not taken care of, is syphilis. Again, syphilis, that gets caught early, gets knocked out with antibiotics, wham, bam, you're fine. But if it is left to develop, and I'm, talking about like for years, even if someone is like asymptomatic, and syphilis is one of those that a lot of people in the initial stages of it are asymptomatic, that can turn into a syphilis infection of the eye, of the brain, and it can cause a lot of problems. But if you're getting tested regularly, then it'll be caught, and you won't have those long-term health problems pop up.
Quick question.
Yeah, oh my gosh, go for it.
I know you mentioned pelvic inflammatory disease. Are there
Yeah.
any like besides syphilis, because I know like the brain issues and stuff will affect all genders, but are there any that specifically affect like people with male organs, that would be like long-term effects that can be?
Yeah. So my understanding is that pelvic inflammatory disease can, in theory, I don't know so much about practice, impact people who are assigned male at birth or people who have penises, but it's not very likely. And that actually brings up a really good point. A lot of essentially like the burden of long-term health impacts of untreated STIs are carried by people who are assigned female at birth or people who have a vagina. And that is, a lot of that is just the way that different organs in the body work, the way that different tissues work. That's also it's kind of similar to how people who have a vagina are more susceptible to contracting an STI when we're talking about penis in vagina sex. They're more susceptible to contracting an STI than a person who has a penis. For that, with like the actual contracting risk, a lot of that is, someone with a vagina has a lot more mucous membrane than that is like coming in contact with than a person who has a penis, where like the mucous membrane is really just like the tip of the penis. So that's part of why we have that difference there. And then, of course, when we bring anal sex into the picture, that adds in some different things when it comes to risk. The partner who is bottoming, the receptive partner, as a general rule, is going to be more like have a higher risk of contracting an STI. Now, I say as a general rule because we do have one STI that is often not considered an STI, including by the CDC, even though it is, that when we're talking about anal sex, the partner who is topping is actually at higher risk of contracting. Now, of course, to contract an STI, you have to be exposed to it. So I'm not talking like, oh, if you're bottoming, if you're topping, that automatically increases your risk. No, the STI in question has to like be present for you to be exposed to. But so Hep C, hepatitis C, very much not treated, and I say this as someone who like I was trained by the Maine CDC back when I did HIV and Hep C testing. Hep C is often not viewed as an STI. Now, part of that is because the majority of people who contract Hep C are not contracting it from sex. They're contracting it from sharing equipment. Even like sharing nail clippers will do it. If, Hep C is really transmittable blood to blood. Now, other types of sex, so like if we're again talking vaginal penetrative sex, there is some risk there about Hep C transmission. Really, the risk there is if there is blood present. So if like, the person who has a vagina is menstruating, if you like cut yourself shaving your genitals, if you had like an ingrown hair that you picked at, and so you've got like an open wound, those are things that with vaginal penetrative sex, we have an increased risk of Hep C. But again, it's still like on the lower side. With penetrative anal sex, Hep C can be transmitted like surprisingly easily from the bottoming partner to the topping partner, which is kind of abnormal just insofar as like how a lot of STI transmission works. And again, is not something that is often covered by, entities like the CDC as far as looking at transmission risk. And again, a lot of that is because there's so much focus on Hep C being transmittable through sharing like drug use equipment, which is obviously important to talk about as well. But like we can talk about more than one thing at a time. Hep C is one of those that, okay, so like Hep C is like kind of weird where because it's a virus, even though you can take medication, which is so much better than it used to be, by the way, like Hep C medication nowadays, oh my God, a breeze. I know someone who had to have Hep C medication in like its early days and it was like going through chemo. Yikes. Nowadays, oh my God, breeze, especially in comparison. I actually talked to someone the other day who was like, oh yeah, I have two friends who did Hep C treatment. They had literally no side effects, which is great and how it is for most people. But so with Hep C, the medication that exists to treat it will completely rid your body of the Hep C virus. Like the Hep C virus itself is totally gone. There's also a percentage of people, last I heard it was like I think 20-ish%, but it's also like hard to get actual data on it, that their body just like clears the virus on its own. Because it's a virus, your body always holds onto copies of antibodies. That's something your body made to be like, hey, watch out for this guy, the Hep C virus. Because your body holds on to that memory of Hep C, but not the Hep C itself with treatment, it's considered like in fancy like medical, settings, it is not considered curable, but that it's treatable. But like if we're talking about just like you're a regular person, our understanding is like a normal person who takes medicine, hep C medication cures it because you finish taking it and like you don't have the actual virus in your body anymore, as opposed to HIV that you got to keep taking that medication forever. And again, those are also medications that have significantly improved over time. And I mean, that's as good a segue as anything into talking about HIV. So, as someone who was, born in the early 90s, it was this, for me, culturally, this weird mix of like my schooling had like pretty much no education. Like my sex ed in high school had like no education around HIV. HIV prevention, nothing about the history. Part of that was the school that I went to. I remember the day that we did cover HIV in class, it was very much presented as only gay people get it, and if you get it, you die. And we went from our health class. My next class was with my sociology teacher, and he asked, like, hey, I know y'all were covering this today. How'd it go? And we told him what the health teacher said, and that man was rip shit. And he shared about how he had lost a friend to the AIDS epidemic in the early 90s. And how with what the medications were now, it's not a death sentence anymore. So I was actually talking with Mikki before we started about like, I used to work with an organization that obviously, like I mentioned, HIV and hep C testing, also did HIV case management. So like I met patients who have had HIV longer than I have been alive. And not only that, these are people who are living very happy lives, very healthy lives, very fulfilled lives, and they have achieved what is called U equals U. So for folks who don't know what U equals U is, it's undetectable equals untransmittable. So as I mentioned, there's HIV meds to take. They are way better than they used to be. They have dialed in the dosaging on it, like they have like figured out new meds. It's way better than it once was. And if someone, they have HIV, and because a lot of, which also again, it is not just like for gay people, the H stands for human. So really the primary criteria for like, am I at risk of HIV? Am I someone who could get HIV? Are you a person? If yes, then yes. But so if someone, they get on the right meds, they're getting care, which there are programs to make sure that people can access the care they need if they get diagnosed with HIV. They get on the right meds and it makes their viral load, the like amount of HIV virus that's in their system, so low that it is undetectable on tests. And if it is undetectable, that person can't give HIV to anyone else. Like that person can safely have, other STIs exist and like pregnancy exists. But that person can have condomless sex with another person, and there is zero risk of HIV transmission. And in fact, because that person definitely knows their status and definitely knows they are undetectable, they actually have a lower risk of giving HIV to someone, because the risk is zero, than someone who is supposedly HIV negative. Because that brings us to the topic of testing. Because a lot of people, as a person who is like a sexually active adult and who, like went to college and had people who were like, oh, I'm clean. First off, clean, that's a little perpetuating stigma. Let's not and say we don't. But you talk to people and they're like, oh yeah. And I'm like, okay, so when were you tested? And they're like, well, I don't need to get tested. I don't have anything. How do you know? Sorry, thirsty. They're like, well, I don't need to get tested. I would know if I had something. And it's like, how? Because I would have symptoms. Do you even know what the symptoms are? And a lot of time the answer is no. Because like with HIV, like the first initial symptom most people get if they have symptoms. Because again, very likely to be asymptomatic for quite a while, is like flu-like symptoms, which is very easily written off as I don't know, the flu.
Yeah, or a cold, or
Or a cold, or like I ate something weird.
you
Um,
know,
yeah, there's a lot of, like, I mean, there's a ton of things that have flu-like symptoms. Hepatitis C is another one that if someone has symptoms, like early on in contracting it, flu-like symptoms are very common. Because that's kind of just like the body's generic response to like, something's happening and I don't like it. But again, a lot of the time, Hep C, HIV, chlamydia, gonorrhea, people don't have any symptoms at all. Um, I've also talked to a lot of people who, when I'm like, how do you know your status? When were you tested last? And they're like, oh, well, I've never been tested, but my last girlfriend got tested. Okay. So that brings up another important point. If I have a sexual partner and I get tested, that does not count as them getting tested. Because like, let's say like this partner has chlamydia, and we're having condomless sex. I am being exposed to chlamydia, but that does not guarantee that I am going to contract chlamydia. Being exposed to something does not inherently mean you'll contract it. There is a risk. What percentage of risk varies a ton depending on like your own health, what type of sex is happening. There's a lot of different factors. So, a partner getting tested does not count as you getting tested, which is like, I do not blame people for thinking that it does count, because the way we get taught about how STIs work in like sex ed is abysmal. I mean, I just always think about that bit from Mean Girls where he's like, if you have sex, you will get chlamydia, you will get pregnant, and you will die. Like that, like it's a guarantee that you have sex one time and you're gonna get chlamydia and pregnant and dead. Like, yikes. And even though it's obvious that like not true, but that's still that idea of like, oh, well, if you get exposed, you're definitely getting it. Back when I did HIV testing, I had someone come in who wanted to be screened for HIV because his girlfriend had tested positive for chlamydia. They had only been like together for a few months. He like was able, like, because like he was able to go see a provider to get tested for like chlamydia and gonorrhea, but they didn't have HIV tests. Yikes. So he like came to a place that had free HIV tests, and he was telling me about this and telling me like, she says she didn't cheat on me, but obviously she had to have, because like, like she like tested positive for chlamydia. And I'm like, well, you obviously didn't test positive, right? And he was like, yeah. And I'm like, and you've been having condomless sex? And he's like, yeah. And it's like, okay, so obviously like you can see that you can have like that exposure does not necessarily mean you're contracting it. So we've established that. But like, it sounds like she wasn't having symptoms, was she? And he was like, no, she just, got her, like, she gets tested when she has her annual checkup. And I'm like, okay. So it sounds like she was asymptomatic and you just happened to not catch it from her. I mean, obviously, it is possible that like there was some infidelity happening. It does happen. But it also, like, yeah, she was asymptomatic. She had, no reason to know that she had it because she hadn't been tested until that point. And like, yeah, this sort of thing happens. And I was actually just talking with a friend yesterday about how with herpes specifically, that like when it presents often like flags concerns around infidelity, when it's just that like, no, things just don't pop up immediately. So herpes is really interesting as an STI because it is so incredibly stigmatized and also so incredibly common. Like I just can't. So I'm gonna start talking about herpes by sharing another like yikes experience from my high school sex ed. So my high school sex ed, there was one day where I like raised my hand and asked the teacher like, hey, I have heard people call cold sores herpes. Are cold sores herpes, or is it a different thing and it just like looks the same? Could you give someone like genital herpes if you had a cold sore and you like performed oral sex on them? Like, could it transmit that way? And my health teacher said no. My health teacher said no, it doesn't work like that. And cold sores aren't herpes. Those are completely different things. So that's a lie. And part of why I had asked that was I am someone who has cold sores. I get cold sores. I really only get them if I'm like super stressed out. God bless L-lysine to knock that shit out. That is not a medical endorsement. I'm not a medical provider. I am a big
No, I know the struggles
for that though. Have you tried L-lysine though?
I have not.
Oh my gosh,
when
okay.
I was younger, my
This is
mom
not medical
actually used
advice.
to use like this denture stuff that would like, it was like denture cream, like denture adhesive that was really chalky and it would dry it right out, but I don't think they sell it anymore.
Okay, so I'm going to tell you my home remedies, and I'm going to preface this with this is not medical advice. This is not medical advice, and I am not a medical professional. I am a person who has oral herpes, and this is what has worked for me. So the more recent thing I learned that I added to my regimen is taking L-lysine. It's like a pill. It's like a tablet. It's not like prescription or anything. I picked up mine at Walmart. It's like just a, they have it in the vitamin section. It's supposed to help with like skin health. I swear it also seems like when I take the L-lysine, it clears up acne, but like that could be psychosomatic. Who knows? So that is one that I learned again from people who have herpes, both oral herpes and genital herpes, taking L-lysine tablets. Again, follow the instructions, talk to your healthcare provider. This is not medical advice. But the first trick that I learned is applying witch hazel and or hydrogen peroxide to a cold sore. Now, because obviously it forms as a blister and then it pops. So if it hasn't popped yet, like to actually get it in there, you do have to like rip it open, which you're really not supposed to do. But like, I'm bad. I pick scabs, whatever. Sue me. I'm definitely like a blister popper. If I get one on my heel, I'm like, no, I'm getting this over with. It'll heal if I do this. I don't know if it actually does. But so, yeah, and so I will like alternate, like I'll take like a Q-tip or like a cotton ball and I'll put some hydrogen peroxide on it and then I'll like, rub that into the open cold sore. And then I'll take the other end of the Q-tip or a new cotton ball and I'll put, because you can get like the witch hazel astringent, it's like witch hazel topical solution in alcohol at like Walmart and even Dollar Tree, and like put some of that on a cotton ball and rub that into the cold sore. My cold sores last 2 days now when I get them. 2 days. They're normally 2 weeks. Amazing. Life-changing. Not medical advice. Talk to your healthcare provider or do Googling. I don't know. But yeah, so this health teacher in school blatantly lied. I mean, I don't know if she knew she was lying, but she was definitely wrong. And in saying that, one, her saying that cold sores aren't herpes, not true. Cold sores are herpes. Cold sores are herpes. There are technically 2 versions of the herpes virus. One of them can only be oral, we think. We've never seen cases of the other one being oral, but like, or rather like, wait, no, I have that backwards. One of them is only genital. Sorry, it's that kind of day. But one of them is both oral and genital. So there's HSV1 and HSV2. As far as we know, HSV2 has only ever presented as genital herpes, but HSV1 can be oral or genital, like for sure. So like, yes, if you get cold sores on your mouth, you can absolutely transmit that to someone's genitals. So that's why it's like, this is part of why it's important to talk with partners about like, have you been tested? Do you have STIs? Because like, there are some STIs that you're like going to have your whole life, and that's okay. That does not mean you have a lower quality of life. Like my oral herpes that I have is the same thing as genital herpes. It's just on my mouth instead of my genitals. It's estimated at least 80% of the population has some type of herpes. And a lot of times I'll talk to people and they'll be like, why don't we test for herpes on like your regular STI panel? Because 80% of people have it. A lot of people have a lot of stigma around it. So when they test positive, they're just going to feel shitty. And that test does not tell you where you have herpes. Because like I could take a like blood herpes test and it would come up positive because I know I have herpes. It would not clear up whether or not I have genital herpes because like I could, I don't know. And herpes is another one of those that a lot of people who have genital herpes never have an outbreak, like never in their life. Or if they do have an outbreak, they only have one outbreak. Now, there is a little bit of an asterisk with the never have an outbreak. Because for a lot of people, if they do have an outbreak, especially if we're talking about people who are assigned male at birth, people who have a penis, but this is true, like, you know, across the genital board, you know, sometimes that, like, just like when I get a cold sore on my mouth, I only get one. And sometimes, even if I don't catch it early, it's really small. And something like that on your genitals would be really easy to be like, oh, I got another ingrown hair. Ugh, because like, you know, that happens. Or like, oh my gosh, I cut myself shaving. And so a lot of the times there are people who like have herpes and they straight up don't know because they technically had an outbreak, but it seemed like an ingrown hair or like a, you know, razor burn or something. And it's, you know, herpes is one of those that very much gets like vilified as like, you have it your whole life and you're ruined and you're dirty and there's nothing that can be done. Now, honestly, prior to the 1970s, like everyone knew about herpes and no one gave a shit. Like herpes was not seen as the scary thing, but then there was this response both from the government and the media, you know, to like the sexual liberation movement that was like, we need to make these people stop being so goddamn slutty. I know what we'll do. Let's shame them about herpes. This definitely won't have worse outcomes down the line.
Sounds familiar.
Yeah, sounds familiar. Sounds familiar. Yeah, herpes is normal. Like chances are you have herpes. Like 80% of the population has herpes. You probably got some kind of it. You might never have an outbreak. That's another thing. There are people who have oral herpes who never have an outbreak. Important things to know with like herpes is so if you are an adult, you pretty much can't contract oral herpes. The exception to that is if you are like pretty significantly immunocompromised. Sometimes people who are really immunocompromised are susceptible to contracting oral herpes. Now, because most people who have oral herpes contracted it in childhood, and they probably contracted it from a parent sharing food with them. Shout out to my mom. But like, whatever, I'm fine. Again, it is at most an inconvenience. And like, aside from the shame and stigma piece, for people who have genital herpes, that's what it is. It's an inconvenience. It is an annoyance at worst. Again, where it becomes damaging is the shame and stigma piece. That is where like it can have a hugely detrimental impact on people's mental health. And it makes no sense that someone who has genital herpes is viewed so lowly, but like me having oral herpes is considered normal. They're the same thing. Like it's the same. I know there was another point that I was getting to with that. Oh, yes. So adults generally, they're not going to get oral herpes unless you're immunocompromised. That's a thing where we see intersections with different STIs. So if someone has untreated HIV that is progressing into AIDS, into autoimmune deficiency syndrome, one of the things that we saw, like prior to having good HIV medications that we do still see in parts of the world, and when people can't access meds, is adults who previously didn't have oral herpes or who did, but, you know, like outbreaks were minimal and infrequent, you know, like contracting or having an outbreak of oral herpes that is like the whole mouth and is like a rough time. That's not fun. That is where like it is a like more of a concern. But the concern there isn't like the herpes is like a symptom of the real concern, if that makes sense. So yeah, like as an adult, like, you know, you don't have to really worry about contracting oral herpes unless you are immunocompromised, and like talk to your doctor about like what you need to do for your safety management there. genital herpes doesn't care if you're an adult or not. Genital herpes like can absolutely be contracted in adulthood. And again, it can be contracted from oral sex. It can be contracted from penetrative sex. Condoms reduce risk, but they don't eliminate it, because where the contracting happen is skin to skin contact. And condoms are not full body, unlike that scene in, I think it's Airplane. I don't know. It's Leslie Nielsen, and it's very funny. They're both just wearing full body condoms. Good, funny movie scene. But so, yeah. But again, it's one of those things where, like, it's not going to ruin your life if it happens. There's also a possibility you already have it and just don't know. And if you like have more questions, obviously you can always reach out to us or like talk to your provider. I think it is important to note there are a lot of providers out there who don't get sufficiently educated in sexual health management for their patients and in taking a sexual health history. So learning how to advocate for yourself around sexual health is really, really important. Learning to ask questions, learning to be like, are you sure? Like, I don't know if that makes sense. You know what your needs are. Now, when I say that, I'm not saying the correct dosage of antibiotics to treat gonorrhea and which antibiotic. You probably don't know that. But you do know how long you've had symptoms, how long you have, how many sexual partners you've had since you were tested last, when you last had sex. Those are things you do know, and you can do the math on, is what my provider saying making sense? Because a lot of the time we are taught to just kind of listen to what a provider says without thinking about it, and it can have negative impacts on our health. So back when I did the rapid HIV and Hep C testing, I was on a CDC contract, so I had to fill out a little demographic sheet of questions. And I had a patient, young woman, doing HIV testing, just being safe, no real exposure risks or anything, just, regular testing. And one of the questions was, have you ever been diagnosed with an STI before? And she said, does misdiagnosed count? And I'm like, tell me more. So when she was 16 or 17, first becoming sexually active with her boyfriend, they used condoms the first time they had penetrative sex. About an hour later, she is having just terrible, burning, itching rash with welts, in and around her vagina. And she's like, yikes, that's not good. Goes to walk-in care, explains the situation to walk-in care. And the walk-in care doctor just says, oh, you have rash and painful welts after having had sex. You have chlamydia. I'm going to give you these antibiotics to treat chlamydia. No, did not provide antibiotics for the partner, even though that is standard practice. Yikes. I'm going to give you these antibiotics. Don't have sex for a week while you finish these antibiotics. That part is normal. Don't have sex while you're I get it. Sex is fun. Don't have sex while you're on your treatment for STIs, or you're going to make a superbug. We don't want that. And always take your whole round of antibiotics. Please don't save some for later. We're making superbugs when we do that, and that is not chill. But so she followed the instructions. And then after a week, and she's all clear to go, she has sex using a condom with her boyfriend. And an hour later, the same thing happens. And then it clicks in her head. Because the whole time she'd been like, well, if we used a condom, how would I have gotten chlamydia? Now, granted, condoms aren't perfect. But that also brings up the other question of, I don't think chlamydia presents after an hour. It doesn't. It absolutely does not. She had a latex allergy. That is not the first person I've talked to who presented with what was pretty fucking clearly a latex allergy. And a provider's just like, you have chlamydia and or gonorrhea. I'm going to throw antibiotics at you now. Have fun. Which is so she messed up her stomach, because antibiotics always mess up your stomach a little bit. To then have the same very painful experience happen again, because the provider at the walk-in care clinic did not bother to take a comprehensive sexual health history. I have another friend who actually someone who I had dated. I am allergic to latex. That's why I'm also like always on the lookout for like, wait, are you allergic to latex? You know, prior to knowing me, had never used latex-free condoms, used them, and then put the pieces together because a couple of years before, after like there were a couple of times where he had had sex, but like he was using condoms, he was being safe, and then he'd go pee after, and it would like burn, but it would only burn like when he peed right after sex, and he was like, "That's weird." Went to go get tested to see what was up. Explained the situation to them. They, you know, run his labs and they called him to be like, "Hey, great news! Like you tested negative for everything. You don't have any STIs." And he was like, "Okay, but why is this happening?" And they were like, "I don't know. Bye. Not our problem." Essentially,
That's not fun when they do
no.
this.
And so he was like, "Okay, I guess this is just how it works." And then, you know, used a latex-free condom, you know, for the first time, and like went to go pee after, and it didn't happen, and was just like, "Oh, wait a second. I think I'm allergic to latex." Luckily, I learned I was allergic to latex from a Band-Aid. Otherwise, it would have been a much rougher experience. Oh,
No, that does not sound fun at all.
no.
So I know something that was like around a lot, like in the media and stuff, like a couple months ago, but like hasn't really been talked about much. Is monkeypox. Do you have like any information that you think is important to know about that?
Definitely. So monkeypox, often called mpox, just because like some people got kind of weird and racist for calling it monkeypox because anyways, so that one's interesting because like it is and also isn't an STI, because like my understanding of it, I'll admit this is one that like I am much less of an expert in. And this also drives home the point, like if you're ever having any symptoms where you're like, I don't think this should be happening, see a provider. Because like I said, with like the STIs, like it's not going to help you to know what all the symptoms are, because you're not going to memorize them. I don't even memorize them. Like, you know, if something's off, get tested. Also just do regular testing if you're sexually active. But with mpox, it's kind of weird because like it both is and isn't an STI, because really what it is that it's like skin to skin contact transmittable. And like when you're having sex, you're having a lot of skin to skin contact is what it is. But like it's also transmittable, like say you go to a nightclub and you are like dancing up on someone. That can also be transmittable that way. And like that's not sex. So that's one of those things where it's like it is often classified as an STI, but it's not really. Like it's complicated because like you don't have to have sex to transmit it, versus like you know, chlamydia, you're probably going to need to have some, like you're not getting it from a toilet seat unless you're using that toilet seat like really really wrong, and even then you're still probably not contracting chlamydia from a toilet seat. You know, you kind of have to have either oral sex, which again, most of the STIs orally transmittable. A lot of them are. Chlamydia, gonorrhea, syphilis, obviously herpes we've talked about. HIV is not, unless you like flossed like right before giving head. So just don't do that. Fun facts. But yeah, or like after having oral surgery. Really don't do that. Sounds like a bad time. Yeah, so pox is and isn't an STI, because again, if you're having sex with someone, like there's at least less clothes involved, potentially no clothes involved, so a lot more skin to skin contact, and you're sweaty, so like really a lot of skin to skin contact. So it's an STI in that way, but like I kind of think of it as like not totally being an STI, because again, like skin to skin contact can happen in other contexts.
Yeah.
I definitely encourage folks to get vaccinated. I am also just like a huge like vaccine proponent. I am a big fan of it. Oh, speaking of, haven't super talked about it. Not HSV, HPV. Get your Gardasil, get your HPV vaccine. Don't get cervical or other types of cancer. If you're a person of penis, you should also get your HPV vaccine, both to protect yourself and partners. To mpox though, I got vaccinated for it. So when it was at like its height, so like last like mid kind of end of summer going into fall is where we saw a lot of pushes around education around mpox, a lot of like fear around it, and a lot of folks who were confused, you know, like why were the CDC guidelines for you know, vaccines for mpox really only focused on gay and bi men. And that's just because like that was the communities we were seeing it in at that moment. It is not, again, it's like with HIV, it's not a gay disease. It's not like, you know, it's not like the virus is like, oh, hold on, let me learn a little bit about you before you contract me. Let me like find out what you're into. No, it's just that like, you know, that's kind of like where that happens to be the population it first popped up in. And so like it's more likely to stay in that population. They then extended it to all trans folks again because of that overlap. Additionally, also like other health disparity risks, because if you have like health disparity risks because you get discriminated against and don't feel safe going to a healthcare provider, you are more likely to contract illnesses and infections, including STIs across the board and mpox. So that is why we saw that there. They also expanded it to folks who are not in monogamous relationships, you know, whether that is like people who are polyamorous or people who are just like having lots of casual sex. Those things are not mutually exclusive, but they're not always the same people. So they you know kind of expanded that there. I have seen that there are some concerns with mpox numbers going back up. I don't know if it's that they have gone back up already or if it's just that like, you know, with summer and more people like kind of being close to each other, because again, it doesn't just have to be through sex, it can be through other things, but also like people going to events and then like hooking up, people getting out there because it's not like cold winter and depressing outside. Literally people wearing less clothes out in public. I have seen, you know, some stuff about, you know, with healthcare providers kind of prepping for a potential uptick in numbers. So it definitely doesn't hurt to go get your mpox vaccine. If you think you're someone who qualifies for it, you can always look into it and check. When I got mine, it was actually through Maine Family Planning, because they had a contract with the state to be able to vaccinate people who were in risk categories. And because I'm trans, even though like, you know, the behaviors that they consider to be in a risk category, I'm like, I don't go out and socialize a lot. I'm a little like I'm a homebody, but like I'm, you know, if I can get a vaccine, I'm gonna take it. So I worked with them and it was, you know, a multi-shot thing. It wasn't bad, you know, it was fine. I didn't have any side effects, you know, from having gotten it. I think it's either closely related to it is related to in some way the smallpox vaccine. So, you know, chances are you've probably had your smallpox vaccine. And if you're fine with that, then like you'll be fine with this. Again, not a medical provider, but that is my understanding of how it works.
Oh, thank you.
But yeah,
that actually brings up another question. So
yeah.
if somebody's like wanting to get tested and they either like don't have a PCP, aren't comfortable going to their primary care doctor, or like are uninsured or underinsured, like
Yeah.
how would they go about like seeing about getting tested?
Yeah. So how they would go about it would kind of depend on where they are in the state, because that would determine like what's available to them. So, you know, if you're down in Portland, Franny Peabody is amazing for like rapid HIV and Hep C testing. I think they have some other like STI testing available there now. I am very bad at keeping up to date on Portland things, so apologies to my Franny Peabody friends for not remembering your full spectrum of testing offerings. My bad. But whatever if they don't have any testing they're able to do, they would be able to connect you with it. Up in Bangor area, Health Equity Alliance, they do free rapid HIV and Hep C testing, and I know they're looking to expand to have more STI testing available as well. Also down, if we're like in the southern part of the state, in the Portland area, Planned Parenthood, they do the full spectrum of STI testing. They got good folks, and they will, they do, you know, basically like a sliding scale thing. If you're uninsured, or if you just don't feel comfortable using your insurance, that's something that comes up a lot with like when you have college aged kids, you know, kids who are like maybe like 20, who they are still on their parents' insurance, but they're like, if my mom knows I'm getting tested, like she's gonna kick me out. So like if, you know, there are situations where you might have insurance but can't use it and like that. Maine Family Planning, they're located all across the state, and I know they do pop-ups sometime as well. They are also a fantastic option. Like I mentioned, they did my monkeypox, my mpox vaccine. It was great. Again, I also just really like vaccines. So, I mean, they have 16 locations across the state. And as mentioned, they do some pop-ups. And then Mabel Wadsworth Center also does testing. I will say we're like a little understaffed and full up right now. Big surprise, healthcare center. But I, you know, that is, as someone who works there, this is how I always get my STI testing done. And they're great to work with. And yeah, I know, like I mentioned with like that person who had gone to walk-in care, something like walk-in care is an option, but they're not always really trained in stuff around sexual health. And I know that these options that I've listed are like very, very much are. And you know, are trained in it in a way that's comprehensive, and they can also talk to you about your risks, and if there are like, you know, are you wanting to get on contraception but you haven't had a way to access it, bam, they'll connect you with that. Are you someone who would like to get on PrEP, which is pre-exposure prophylaxis, which is basically like birth control but for HIV? What do I mean when I say that? It's something you take every day and it makes it so you don't get it. PrEP is like, honestly, it feels like magic, that it is a thing that exists and almost no one knows about it. Like, I think the last time I checked the data, and hopefully this has changed, but only 1/3 of providers in the country, let alone a rural state like Maine, 1/3 of providers in this country knew about PrEP.
Yeah, it's crazy.
About, I mean, as like a queer person, and you know, I think about how before I was like conscious of it, my community was absolutely decimated by HIV AIDS because of the government's refusal to do anything about it. And now, you know, not only do we have U equals U, but we have PrEP. We have this almost like magic medication that makes it so people can't get HIV. And like, so many providers don't know it exists. And if they don't know it exists, how are the patients going to know it exists?
Yeah.
Another thing that is an option that, you know, if you go see a provider for STI testing, you can talk about like if you think PrEP is right for you. And again, the biggest risk factor for HIV is being human.
Yeah.
That's the biggest risk factor for HIV. Obviously there's like different types of sex that have higher risk. Anal sex is higher risk for contracting HIV because of the risk of, you know, having micro tears happen in the rectum. It's more likely to happen there than in the vaginal canal. So, you know, there's just, because again, exposure does not automatically equal contracting. So, you know, when there are other factors like that increase contraction risk, that's, you know, that's where you're more likely to get it. But yeah, really, again, the biggest risk is just straight up like being human.
Yeah, and I will just throw a quick plug in there for Maine Access Points. We do offer at-home HIV tests, and we offer also linkage to care if in the future or currently someone's looking for linkage to care. and can't remember like the different options, or is looking for like some advice on an area closer to you, definitely reach out to us. We listed it in the chat, but you can call, text, or signal 207-370-9445. And we can send the at-home HIV test right through the mail.
Yes. And I want to like emphasize the point, because HIV is something that is still like really, 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 really stigmatized in our culture. It's both like stigmatized and made fun of in a way that's like very yikes. Like on the one hand, it gets presented as like, this is a death sentence. And it also gets presented as, haha, funny. And it's like, pick one. Pick one. That's weird. Pick one that's weird. It's actually not either. But yeah, like people absolutely live fulfilled, happy, healthy lives with HIV. And the most dangerous thing about HIV is the stigma, because that's what perpetuates its spread, and that's what stops people from accessing treatment. And that's what, like, there are people who do get rejected by their community and by their family because they have HIV, and because people have been lied to about what HIV really is. You know, I mean, like I said, someone undetectable, like you can straight up have condomless sex and you are fine. That doesn't, we don't know about chlamydia or gonorrhea in that situation, but like HIV, we're fine. But like, there are people who think like, oh, I can't eat this thing that this person with HIV cooked. Yes.
Yeah.
And what? Even if they did something weird, which I don't think they would, but even if they did something weird, you're still not gonna get HIV from it. I mean, I remember it was because Princess Diana has been very much on my mind lately for reasons. And one of the things, obviously I was a child when she died, but like one of the things that was so big and important that she did was she shook the hand of and hugged a person with HIV that had progressed to AIDS. And at that point, nurses would leave food for HIV/AIDS patients outside of their hospital room. They would not go in. Families would partly out of like misguided fear and partly out of shame, partly out of homophobia, like families would just fully abandon, their former loved ones, who had been diagnosed. And like overnight, Princess Diana doing that changed the game. We started seeing like that hospital staff would actually have interactions with. They would go in the same room as these patients. They would actually there would be someone to hold their hand while they were there. And it's just hard because we now know how it works. We have a really good understanding of how it is that HIV works and how we treat it and how we prevent it. And people still get rejected by their communities. And, it's our responsibility to stop that. And if you are someone who tests positive for HIV, it's also important to remember that are there people who will have a shitty attitude? Yes. But there's also a huge community of people who will uplift and support you.
Yeah, definitely. No, so I think that's actually a great point to end on. Do you have a way that people can reach out to you directly if they have any questions? You can always reach out to us at Maine Access Points.
Definitely. Y'all can have my email. I'm gonna apologize. It's a little hard to spell, but it is Ruhlin, RUHLIN at mabelwadsworth.org. If you forget my email and you need to reach out to our lovely folks at Maine Access Points, y'all have my permission to share it. I'm going to type it out real quick so we have the right spelling to put that in the chat. Oh, good. I spelled it right. Sometimes I typo my own name. It's like that sometimes. I type too fast is why. Absolutely feel free to reach out. I am more than happy to answer questions. As established, I am not a healthcare provider. I can't diagnose you with shit. But I can talk to you about hey, here's where you could get tested. Or hey, sounds like you might want to get tested. Yeah, I'm a big advocate for getting tested. Like if you're sexually active, every 3 to 6 months.
Awesome. Thank you so much.
Thank you so much for having me.
Yeah, it's been such a pleasure having you. Thank you. And thank you to everybody that attended.
Thanks all.